პროექტს ქვია ჰელსჰაბი. ჩვენ ვაუმჯობესებთ ფარმაცევტულ ჯანდაცვის და დიაგნოსტიკურ ბაზას საქართველოში და მსოფლიოში. საკმაოდ საინტერესო ბექგრაუნდი აქვს, ასე ვთქვათ, ურთიერთობის უკვე. ჩვენი გუნდი 2 წელზე მეტია საკმაოდ აქტიურად და პროდუქტიულად თანამშრომლობს სხვადასხვა სტარტაპებზე. გვაქვს საერთაშორისო ბაზარზე გასვლის წამლებისათვის პრაქტიკა სხვა სტარტაპთან ერთად. ასევე ჩვენი გუნდის წევრები არიან წამყვანი ჯანდაცვის წამყვანი წევრები, რომლებიც აღმასრულებელ პოზიციაზე მუშაობენ სხვა ფარმაცევტულ და ჯანდაცვის ჯგუფებში და საკმაოდ გვეიმედება დღევანდელი დღე. ჩვენ პროდუქტს ქვია ჰელსჰაბი. ინოვაციურობა მდგომარეობს იმაში, რომ ჩვენ ვაკავშირებთ მოთხოვნა მიწოდების ჯაჭვს ერთმანეთთან, ანუ პაციენტებსა და ფარმაცევტულ კომპანიებს, ასევე ჯანდაცვის პროვაიდერებს ყველაზე ეფექტურ და ყველაზე სწრაფი გზით. ერთი მხრივ ხდება ხარჯების დაზოგვა ფარმაცევტული და კომპანიებისთვის და ჯანდაცვის პროვაიდერებისთვის, ასევე ჩვენი პაციენტებისთვის მნიშვნელოვნად ვაუმჯობესებთ დროის მომსახურებას, ანუ ავცილებ დროს და მნიშვნელოვან სახსრებს ვზოგავთ ჩვენი ინტუიტიური და ეფექტური ვთქვათ ბაზრის ონლაინ ბაზრის მეშვეობით.
Welcome.
Good afternoon, ladies and gentlemen. My name is Georgi Bejdashvili. I'm a CEO of HealthHub. This is Joshua Rechsteiner, COO of HealthHub. So imagine at the same time your customers know what they want to buy, you also know it. And you can push notify them with the corresponding offers, and all they are left with is to confirm and push the button to confirm the order. HealthHub is a proactive online marketplace for drug, diagnostics, and treatment. We provide win-win situation for the supply and demand side. By supply and demand side, with the pharmaceutical and the patient side.
To get cash positive as soon as possible, we are going to focus with the MVP on the market for pharmaceuticals first. Also because there we can build on existing IT infrastructure. When this model will be already cash positive and when we will expanding internationally with that part of our business, we are going to add services related to diagnostics and treatments, which will be built upon EMR blockchain technology. And the good thing is that at this point in time, we will already have built consumer confidence with our first stage MVP, and we will have already delivered tangible monetary value to our clients. We will also offer market insights based on big data analysis, and you can believe we are going to process a lot of data.
So how are we actually going to disrupt that market? As you can see, there are a lot of middlemen between the producer and the final customer. So what we're going to do is we're going to remove some of them while offering the others. The most intuitive and efficient marketplace where they can sell drugs, treatment, or diagnostics. Thus, HealthHub offers the suppliers with the least complex cost structure, and by offering these cost savings for extensive branch network or high-value marketing campaigns, and thus, without that, even suppliers with the least cost structure can benefit out of it a lot.
So let me show you how it actually works. As soon as the doctor has submitted the electronic prescription, our system takes the data and retrieves pricing information from associated pharmacies and B2C wholesales to generate the cheapest offer and send it directly to the patient via SMS or through the app. So all he has to do is to accept the offer if he likes it and to decide where to pick it up.
There is pharmaceutical market is one of the largest globally. We will start in Georgia because we believe it's a nice sandbox to experiment and then going regionally, and then we expand a global market.
This brings us to our competitive analysis. So our competition consists mainly of drugstores, online pharmacies, B2C wholesale, and price comparison tools. It's basically every point of sales for pharmaceuticals. So you all probably are familiar with this picture, and unfortunately still today, complex user interfaces are still common, and this is especially true for these competitors. So we thought how to be one step ahead of the competition, and we went after Apple's principle, and nowadays we simply have an order button, which is like Amazon's one-click buy on steroids and with a crystal ball.
So one of our competitive advantage, which is the greatest advantage, we can access our patients where nobody from our competitors can, on the earliest stages, meaning in the doctor's room itself. While theoretically, after they went out from the doctor's room, they can input and search the medication for the best price. But however, by that time, they would probably have been already accepted our offer.
So let me sum up our unfair advantages. Also we have exclusive access to customers. Our hassle-free and proactive system can process complete prescriptions at once. And it's specifically designed for the less IT-literate but high-value clientele. With automatic servicing and subscriptions, client farming is as easy as it can get.
So we have pretty experienced and mature team. We are comprised with the startuppers, existing startup owners and operators. We do operate startups, enterprises. One of our co-founding members is the director of the most modern and the largest clinic within the largest healthcare group, possessing more than 35% of the market share. We have professionals from software development, legal, consulting, healthcare, and product and project management.
Of course, we have already built alliances from within our network. Among these are, also on this slide, you see existing alliances and parties with whom we are still on the evaluation phase. It's like also healthcare groups, business associations, governmental bodies, and especially, of course, pharmaceutical supply-side participants.
So our go-to-market strategy would be quite aggressive, but we would concentrate on the field of direct sales, channel sales, and we also use internet sales. And by adopting appropriate PR and marketing measures, will help to grow our sales soon.
We forecast to reach break even after roughly 1 year. This calculation rests on pretty conservative assumptions, like only 50% of the requested funds are spent in the model. It's only a drug market, only in Georgia, no expansion, no additional services, not more than 2% of the market share. And what we currently lack to get a more attractive forecast is more precise data about customer segments in the market and their spending behavior, to identify the most attractive groups of pharmaceutical customers.
So we request for the seed A, we request $350K US to reach the break even, but only 45K we need to create the MVP and roll out the beta testing. We will use 30% for to making the product, while more than 50% to market and sell it.
So thanks for your attention. We disrupt the drug and healthcare market for the benefit of society, and you can become part of it. I hope you have questions.
One question. I didn't understand the unfair advantage or access that you have. Could you explain that a little bit more?
Exclusive access.
Exclusive
you had on
access,
that chart.
yeah.
It's more habit and convenience driven, because if you are sitting at the doctor's office and you just receive your prescription, you usually don't have time or you don't want to access competitors' services through the app. And you would have to enter each line item of the prescription after each other and compare everything and check out, yeah, maybe one pharmaceutical is cheaper at provider A, but the second one is cheaper at supplier B, and you simply after the second drug you will research the prices, you will stop the action because it doesn't make sense at all.
So where do you get the data concerning the what the prescription actually is from the doctor? How do you know that?
We get data from RX. It's an online tool used by our pharmaceutical market. It's provided by government.
In Georgia?
Yeah, so once the medication is prescribed, it goes automatically to the system, cloud system. We access that data and double check with our suppliers like wholesalers, B2C wholesalers, online pharmacies, and generate the cheapest price, as Joshua said, based on the whole cart and not only for the whole basket and not only for the one medication. This concept actually is a data entry-less e-commerce, which I assume could spread to the different industries. But we start with healthcare because it's tremendous market, and total available market for healthcare is even bigger than the drugs, which is 7.2 trillion. So we will.
Is the market for prescriptions in Georgia, is the product the same cost for everybody?
I don't
like if you and I are prescribed, will I have any difference in what I'll pay for a prescription based on, you don't have a concept of private health insurance here, right? Like where?
There are some insurances, of course, but it's so as in the US, I don't know the exact numbers, how much is paid out of pocket in the US, but here it's about 60%
is paid out of pocket and 40 is 35.
And you know what that balance is going to be based on what customer input or the information you're getting back from the prescription exchange. How do you know?
Also the customer first of all grants us access, yeah, because it's private data. And we have to comply with the privacy rules. This is clear. And I think you, in the US, as far as I know, you also have ERX system, right? And yes. So the thing is just to comply with the existing rules. And actually, our system could even be not a threat to privacy. It could improve privacy. And then we can take this subscription information and simply compare it, retrieve the relevant pricing data from the pharmacies.
Got it.
And if a customer has insurance and there are maybe some people want to subscribe to a certain medication because they need it continuously, then our app will be able to also offer the best value for these kind of patients, because they are, of course, the highest. I mean, chronic disease. Yeah, there you have the biggest affordability problem. Or you have the biggest check sizes if you need something really expensive, and then continuously it's for us the most interesting part of the market. And we think that it's also possible to interact with insurances actually, because for them it's also valuable.
So sorry, let me go back to the point, because in the U.S., as I mentioned last week, we've had a study done that from pharmacy to pharmacy, the same drug can vary by as much as 7 times for the same drug, driving down the street from one to another.
Yes.
Is that happen here, or is the price regulated by the government?
It's happening here as well.
Okay,
I think it's happening in all countries except where you have price dictation.
Okay.
Because there are incentives in the market to behave like that. It's normal.
Yes.
I would stress that from the capital to region, it vastly derives from each other. Yeah. But mainly it has the margins, the capital versus the regions. So there are a lot of room to cut the margins. As you correctly mentioned, it goes to up to 10 times. From one to another drugstores.
And here, region versus capital, you have another between 20 and 50 or even more % margin just because it's in the region.
Okay.
So I think when you roll out the e-commerce piece, are you initially going to target a couple pharmacies to work with? Is that the idea?
Yeah,
sure. We are going to cooperate with B2B, B2C wholesale specifically, and target the smaller drugstore chains because they have the biggest incentive to adopt new technology to fight for bigger market shares. And the cooperation, until the launch, we will in any case cooperate with some B2C wholesale companies to make sure that we are able to deliver the customer value which we are promising. This is massive price reductions. And if we have a cooperation partner who does not have a branch network, which burns his cash and basically only has to operate a logistics center and does not need marketing, advertisement, and so on, then we will be able to fulfill our promise.
So as you expand outside of Georgia, I would, if you come to the US, I would recommend getting some advisors who understand the insurance.
Yes.
I mean,
Great point.
the insurance business in the US, because what you will find is insurance companies have pre-negotiated many of these things, and for the patient, they really don't care in many cases. So if it's billed at Walgreens or CVS, it's wherever the insurance company says, when you go there.
Yeah.
So,
But that is starting to change now.
It is.
Because the Obamacare, one of the good things about it, is forcing that visibility to the difference in pricing and causing competition that didn't happen before. And the insurance companies are pushing that because they've been incented to push that now.
so they'd be a big partner. So having
Yeah,
an advisor
exactly.
who understands that is going to be really
The whole
important.
ecosystem, by country, because it's very
By
different country to
Yes,
country.
that's a
actually by state.
good point.
Yeah, exactly, yes. Very good point, even by state in the US.
Yeah.
Okay, wonderful.
Thank you very much.
Thank you.
რა ვიცი, წარმოადგინეთ ვენჩერულ კაპიტალისტების წინაშე საკმაოდ კარგად ჩვენი პროექტი, ჯერა რომ საკმაოდ დიდ გაინტერესება ხვდა წილად, საკმაოდ საინტერესო კითხვები იყო თუ როგორ უშუალოდ მივახცევთ წარმატებას. ერთად მე და ჯოშუამ ვთვლი რომ საკმაოდ დაუმწურავი პასუხი გავეცით ინვესტორების კითხვას. ეხლა უკვე მათზე და ჟურის წევრებზე არის დამოკიდებული ჩვენი წარმატება და რეალურად ქვეყნის წარმატება, იმიტომ რომ იმ პროდუქტს, რომელსაც ჩვენ ვაპირებთ, რა დავუქვეყოთ საქართველოში და მსოფლიოში გავიტანოთ, მნიშვნელოვნად შეუძლია საქართველოს და მსოფლიოს შეცვლა.